In medical rounds today, September is Thyroid Cancer Awareness Month. And like other cancers, if it's caught early, it can be treated. Here now to talk about symptoms and treatment is Hartford's Healthcare Dr. Carrie Carcella. She's an endocrine surgeon at the Hospital of Central Connecticut. Dr. Carcella, thank you so much for being here. First, for people who aren't familiar with it, where exactly is our thyroid and what does it do?
Sure. Thank you for having me. Your thyroid is an endocrine gland that sits here in your neck, and it's shaped like a butterfly. I do have a model here, and this is what it would look like underneath the skin, where the gland sits right in front of your airway, positioned lower here in the neck. The thyroid's very important because it produces a hormone which regulates our temperature, our energy, our heart rate, and many other important functions within the human body.
What are the symptoms of thyroid cancer and how can people self-screen?
Sure. So a lot of patients may not have any symptoms at all, which is why it's extremely important that individuals are seeing their primary care physician and they're examining their neck to ensure that there aren't any nodules or masses. But some individuals may actually identify a lump in their neck or possibly have some difficulty with swallowing or some voice changes or a dry cough that can't be explained by other medical problems.
How does someone get thyroid cancer? Are there certain risk factors?
Yeah, so the majority of patients may not have any specific risk factors, but the risk factors that we are aware of are family history and exposure to radiation. There are some newer studies that are coming out where obesity may be a factor, but definitely women are more likely to get thyroid nodules and thyroid cancer more than men.
And how is it diagnosed and what are the treatments?
Sure. So initially, an individual will likely, after a physical exam by their primary care physician, if felt it's warranted, proceed with imaging, which usually would be an ultrasound. And then if a nodule is identified that has concerning features, then we typically proceed with what is called fine needle aspiration. And it's important to note that a lot of thyroid nodules, more than 90%, are ultimately benign, which is why it's very crucial to be seen by a specialist so they can both evaluate the imaging and then proceed with those aspirations of the nodules that have concerning features.
Very informative. We thank you very much, Dr. Carrie Carcella. We appreciate it. For more information, you can visit hartfordhealthcare.org/cancer, and we'll connect you to its website on the Channel 3 app.